I don't like to drink that much, but if I do, it should be at the start of the new year. Okay. But I should do it. I'm going to try it this month.
Yeah, I could, but it wouldn't be very fun, so I don't think I would do it.
Just because I want to be sure that I'm able to do 28 days without alcohol. I think it's possible, you know?
No.
No?
No.
Not at all.
Well, you know, it's just, January, you know, something to drink. It'll be warm, right?
We took to the streets of Montreal to ask people if they would consider doing a dry January, of course, which is, stopping all alcohol consumption. There's some of the reactions we got. We're joined by Dr. Zach to talk about this because alcohol consumption, you know what, a lot of efforts concentrated on cannabis consumption. Yeah. And I think we forget that alcohol consumption is, for some people, and a lot of science shows perhaps, as dangerous or even more dangerous. What are the dangers, first of all, of alcohol consumption?
Well, and first of all, I agree with you. And it's been legal for a long time. Yeah. So people don't necessarily think of it as a dangerous substance. But, working in a hospital, we see a lot of people with problems. So the obvious ones are liver damage, obesity. It's associated with increased risks of certain cancers, including breast cancer, stomach problems, heart problems. There's a whole host of them. But there's always the balance, right? There's moderation versus excessive intake, and excessive intake is really the problem. And it's for those people who maybe feel like they don't have good control over their intake, and who the alcohol is affecting their life in a negative way. Those are the people who really, it's a good idea to really put the brakes on it.
Yeah, you have to get help. And we've heard a lot of binge drinking, right? And I don't think people understand exactly what binge drinking is. How do we associate that? What exactly is it?
Well, binge drinking basically is enough to get drunk in a short period of time. Okay. And so the definition, so the maximum people should have, just in terms of the Canadian guidelines, the maximum number of drinks per week for a woman is about 10, or is 10, and for a man is 15, and with no more than 2 a day for women and no more than 3 a day for men. But by the way, that's a maximum, and it used to be lower. I was actually surprised by how high that is in terms of maximum. That's pretty high. I would actually recommend people have less than that, but that's an absolute maximum. Okay. Binge drinking is when you're going more than that per day. So certainly men, once you've had 4 a day, that's quite a bit. Women, once you've had 3 a day, is quite a bit. And especially if you don't, well, no, I shouldn't say especially, but if you don't drink regularly, but you only drink, say, on weekends, that sort of thing, but you're drinking a whole heck of a lot, right? You're drinking whatever, 10 drinks, then that's clearly binge drinking, and it's not, either way it's bad. It's not good to drink too much every day. It's definitely, but it's also not good just to drink on weekends an excessive amount. Both are harmful.
What is defined as a drink? Like how much is a drink?
Yeah, exactly. So, the truth is I know ounce is better because they're easier to remember. But basically a standard beer, which is 12 ounces, which is about 340 cc's, that's one standard drink. A standard glass of wine, which is about 5 ounces, or a shot of one of the hard alcohols, which is 1.5 ounces. Okay. Those are sort of a standard drink. So when we talk about, a maximum of 10 a week, that's 10 of those kind of drinks. Because, when people say, sometimes they say, I drink 10 beers a day. But if there's those massive king cans, then that's more than 10 drinks. Oh, yeah. That's like 20 drinks.
And 10 of anything, by the way, is not good, as we just said. What about, we've seen studies as well that say, hey, you know what? There are some benefits to drinking in moderation. Are there any truth to those?
Yeah, that was very popular, right? When those studies
came out, everyone went, yes, red wine!
Exactly.
2 glasses a day.
So you're right, and especially red wine, they've done some studies, and there is some evidence that moderate drinking, like 1 drink a day, especially of red wine, can decrease people's risk of heart disease, maybe diabetes. But it's a slippery slope, and most people don't drink just 1 a day. However, having said that, if you have 1 glass of red wine a day, it's fine. It's not dangerous. But I would never recommend to anyone to start drinking because for the health benefits. It's not. Yeah.
I want to talk about dry January because we saw a reaction from people on the streets, and a lot of some of them saying, "Yeah, I tried," and some of them, "No way, not a chance in it." If you are let's say if you are a heavy drinker and you decide, hey, my New Year's resolution is going to be stop drinking cold turkey. Are there dangers in doing that? Should you be talking to your doctor?
Yes, absolutely. So for most people, stopping drinking is not a huge deal, and it can have benefits for sure. Like when they actually study it, they see that people have better wellness, better skin, better immune systems, they sleep better, those sorts of things. But some people really can't safely stop. And those are the people, in the emergency department, there's certain things we see, right? Okay. There's people who are really alcoholics and also people who get into fights and liver disease and heart disease, etc. But people are really, if you're alcoholic and if your body is dependent on it, it is really dangerous to stop. And we see those people in the Emerge.
Right.
And basically those people really need to stop with medical aid because it can be life-threatening if they stop cold turkey. So not everyone should stop. If you're a regular drinker and you feel it, most people know if they don't drink for a day, they start to feel sick.
Yeah.
If that's you and you decide to do a dry January, good for you, but better to see a doctor and do it with under medical management.
Obviously, so, not everyone should try a dry January, but if you're a moderate drinker, as you just said, right, there's no problem at all. I mean...
Yeah, why not?
We should encourage it.
Yeah,
right?
absolutely. There's no harm in doing it. It's only if you're a heavy drinker, don't stop all at once. But you just may find that you're sleeping better, you're feeling better. And the other thing they find is that people afterwards feel more able to refuse drinks. When they study people 6 months down the road, not everyone stops drinking completely. A lot of them don't. But people do feel a little bit more empowered to say no when they don't actually want it, right? If you want to have a drink once in a while or even regularly, that's fine. But if you're doing it for reasons, you're feeling pressured into it or whatnot, then if you feel empowered not to and you feel better as a result, good for you.
Yeah, I couldn't agree more. A great thought to end this on. Thank you so much for joining us. Always a pleasure having you. As usual, if you visit btmontreal.ca, if you click on our blog section, all this information and more from Dr. Zach is available to you.